Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah wa salatu wa salamu ala rasulillah wa sahbihi wa man wala. Thank you for joining us again today. This is our fourth webinar in our series, the last one. We've kept this one a surprise for you all, and today we are so happy and joyed to have joining us Imam Suhaib Webb. And I'll give a brief introduction, and then inshallah we'll jump into a conversation with Imam Suhaib Webb. Imam Suhaib is adjunct professor at the School of Public Service at NYU's Robert Wagner Graduate School of Public Service. He has a degree in education from the University of Central Oklahoma and a degree in Islamic law from Al-Azhar University in Cairo. Imam Suhaib has not only studied at Al-Azhar, but also holds a number of licenses from other traditional scholars. And he has, in numerous occasions, been named as a faith leader to watch by the Center of American Progress. Has been selected by the Muslim community as one of CNN's top 25 most influential leaders, and I think has been on the circuit speaking with specifically Muslim youth and others in terms of really grounding their faith in the United States of America in turbulent times, in various times. Someone I have looked up to myself as well in terms of a guiding light, so to say, coming up through Muslim student associations and other work, and we're so excited to have him today join us. To talk about the work of UMMA, kind of the work we are right now in terms of health and equity, why it's so important to be able to also see this as a civil rights issue. Health and equity is one of the most, I would say, inhumane kind of factors in the United States where you have such disparities, and it's often based on socioeconomic status as well. So with that, Imam Suhaib, welcome, and we're so glad to have you.
Assalamu alaikum wa rahmatullah. MashaAllah, it's an honor to be here.
Imam Suhaib, we are entering the last 10 nights of Ramadan. We're in the last 10 nights of Ramadan. Can you talk about a little bit about how this Ramadan experience has been for yourself personally as well, in terms of adjusting where everyone is calling the new normal, in terms of both our not only day-to-day practices, or maybe our spiritual practices have been affected. We don't have the ability to build community, and what guidance do you have on folks of really maximizing the last 10 days of a very unique Ramadan that we have before us here today?
Yeah, most definitely. I mean, Bismillah, alhamdulillah, wa salatu wa salamu ala Sayyidina Rasulillah, ala alihi wa ashabihi wa man wala. First, if I can just say something before we jump into answering the question about OMA Clinic. I converted to Islam in 1992, which is interesting. It's kind of the year that OMA Clinic began to formulate and formalize. And then I think in 1996 is when it launched. I remember I came out to LA in 98, 99. I was still a college student with MSA West, Talib magazine, the old days. Things were much more politically alert, I would say, than perhaps they are now. And running into like Yasser Aman and these guys and being, informed of like this vision. And then, I think it was Yasser who was like, hey man, can you come by the clinic? And I think I was like in Orange County or somewhere like in the middle of nowhere, probably Irvine. And I remember we drove out, to the UMMA Clinic and was able to observe, early on, right? Like very little resources. There wasn't 70 people on staff like there are now, mashallah. There weren't 2 clinics like there are now. But there was like this vision through a Muslim perspective to serve the nation's poor and underserved when it came to their healthcare needs. And I just remember being blown away, man, and saying like, this is Islam, right? Like, this is where Islam should be, alhamdulillah. Now you can ask that question again. If you can edit, it's good. I just thought like it's important to give like a personal passion. You know what I mean? Are you able to edit?
Yeah, we'll just keep going, inshallah. Okay. And I think that's definitely, a unique perspective in terms of how you were first introduced to the work that you've actually been to the clinic. I think for many of the folks who may be listening, they haven't been physically seeing the work that's being done. Alhamdulillah, maybe they haven't had the need to come to a clinic like UMMA because they have health insurance. But given the circumstances we're in now and some of the unemployment numbers that were released today, everyone you're seeing on unemployment is eligible for Medi-Cal, right? At least in California, it's called Medi-Cal. And so our numbers are going to continuously increase. And it's always, a different stereotype people have of like who accesses our services. But, we're all one pay or 2-3 paychecks away from having to go to, any other healthcare provider that can provide services to if you're not unemployed. And majority of our patients are either transitioning through that or have life circumstances that have kind of situated them where that clinics like UMMA Clinic are the only option they have in the safety net. And so they're not going to the ERs, they're coming to clinics where they can take care of their healthcare in long term. So going back to the main question, these last 10 nights of Ramadan, in this unique Ramadan, kind of wanted to hear from a personal perspective of how it's been for you. I'm sure there's probably been a webinar every hour for you, or some type of communication happening via social media or via phone. But how have you been able to maybe adapt, or what lessons and challenges have you gained from this Ramadan? Allah subhanahu wa ta'ala has given us an opportunity to feel such a unique experience, and what are the takeaways that you've come away with in this month?
Yeah, I mean, first and foremost, I'm a New Yorker, right? So I live in Brooklyn. I know I see you smiling. I know that kind of rivets my LA people. My aunt lives in Anaheim, so I got love in LA. And I'm a Boston Celtics fan, which of course, is going to add to some of the angst that may exist between us. But I live in New York City, and my wife and I was mentioning to you before we jumped on, we're very sick actually early on in early March, and had to try to, even though we have insurance through NYU, having to navigate that process of a lack of infrastructure. At that time, no one really knew what was going on, and not being able to find testing. And then my daughter was sick, and she was only about 8 months old. And then eventually, seeing what happened to the city. And then Ramadan happens, right? So it's been a very unique Ramadan. And then I think the irony of this Ramadan, and I wrote about this yesterday on Instagram, is that, there's a number of viruses in America that need vaccines. It's not just this one. And this virus, especially in Ramadan, our sense of justice should be heightened. Our sense of iftiqar, impoverishment to God, is heightened. Ibn Abbas said the Prophet became more generous, and the word ajwad means not just generous, but like the quality of his concerns became more, like karih al-mursala, like his generosity was like infinite in Ramadan. So we saw just a few days ago, the film came out of this Black man who was killed and shot brutally. The virus of white supremacy is very much rampant in America. Whites need to flatten the curve. Like, we need to flatten the curve, right? Maybe we need to quarantine ourselves until we can act in a way that doesn't hurt people. We see the economic disparity brought on by COVID, definitely in New York City, where I think 60 to 70% of the boroughs impacted by the virus are those that are in areas that are underserved and sit under the poverty line. So for me, this Ramadan, it's been so many things, man. It's not just like your private Ramadan, but then also like all these things are happening around us. And just today I saw Senator Sanders, tweeting about like healthcare is a human right, man. Like healthcare is a backdrop of society that no one should ever have to question. And I've lived in my life where I've been poor enough where I had to go into clinics. I had to go into the emergency room for a blood clot. I had a $125,000 bill, for pulmonary embolism. It's not easy for people. And I think like if we look at the month of Ramadan, for me personally, it's just like navigating all these different kind of issues within the backdrop of not being able to go out. You're inside. And as you said, you're doing a webinar every 30 minutes.
And so, as I think, especially young people, we've gotten a lot of questions over this month in terms of, people's lives are fundamentally changed. This is one of those cataclysmic moments where, first we thought, oh, it's going to be a week, it's going to be 2 weeks, okay, maybe 3 weeks, and now we're getting into 2 and 3 months, and you have people who had certain plans in terms of what they wanted to do when they graduate, from high school, from undergraduate school, getting into graduate school, and going on, and their plans are either on hold, or they have to readjust, or maybe have to put some things on hold. Maybe they have to go find work to help a family member. I mean, there's so many multiple factors that are happening. And given the uncertainty, right, what spiritual advice do you have that, what tools can we use as Muslims, and actually, people of faith? I mean, I think anyone who's listening, who's maybe even out of the Muslim faith, that you've been able to, we've been able to demonstrate of using to be able to respond to this uncertainty. So what have you seen, and what advice can you give?
Well, this is not our first rodeo as a community with plague. I mean, the Muslim world has been, even quarantine, there is, a few people say that the word quarantine is from Arba'in, from Ibn Sina, who in his famous canon said that, in the face of pandemics, epidemics, or plagues, a minimum quarantine should be 40 days, right? Arba'in, and then translated into Latin, and then into quarantine. Wallahu alam, the truth of those kind of things, but it's kind of cool. But even in the Quran, right, you find the ants in the time of Sulaiman, when Sulaiman and his army were walking, and they were scared that this army would step on them. Adkhulu masakinakum la yahbitanna Sulaiman wa junudu. You should quarantine in your homes. It's what the ants said to the other ants, right? You should stay in your homes. So we are, as a spiritual community, this is not our first rodeo. We can talk about it later on, perhaps the history of kind of epidemics and pandemics and how Muslims reacted and dealt with it. The first one happened in 17 after Hijri with Sayyidina Umar ibn Khattab. But of benefit, and the reason I say that is that you have scholars, especially with the bubonic plague, who wrote about the virtues of interval isolation. Like Muslims, we believe that interval isolation, like kind of like a high intensity workout, which is good for your cardiovascular health. Well, there is this high intensity interval isolation, which is good for spiritual health. Imam Ibn Ta'ala said, "Ma nafa'a al-qalba shay'un mithlu uzlatin yadkhulu fiha biha maydanu fikra." That nothing is more beneficial to the heart than a moment of isolation where the opportunity for introspection takes place. So there are virtues of being in this situation. One brother called me and said, I haven't been able to drink. Like, this has helped me with my substance abuse issue. I don't have access that I used to have. So there's also khayr in it. I think it's important that we would reflect on 4 things. And even Allah mentions this in talking about the etiquettes of isolation. Number 1 is that he says, how can you have a relationship with God and see God if your heart is smeared with surah akwan, if your heart is smeared with the material? So like, first is it allows me, and what he's saying is to question my values. Like, where is my heart? And then he says, كَيْفَ يَرْحَلُ إِلَى اللَّهِ. And how can you travel to God in these moments of isolation if you are enslaved by your desires? So the second is, being isolation allows us to distance ourselves, like the brother I mentioned earlier who had substance abuse problems, from some of the evil desires that we may have. The third thing he says is, how are you going to yadkhul hadrat Allah? Are you going to really engage in a meaningful relationship with Allah in a pure way? وَهُوَ لَمْ يَتَطَهَّرْ مِنْ جَنَابِ غَفَلَاتِهِ. And the person hasn't moved away from negligence. And then the last is repenting from sin. So there's like 4 things we can think about. Balancing priorities, right? And taking an inventory of our lives. Number 2 is stepping away from our lowly desires. Number 3 is being aware of our negligence. And then number 4 is repentance. I have students at NYU who are not walking, as graduates, and they're very frustrated. And I understand, we have a number of high school students who are graduating across the country, some with great accolades in the Muslim community, who we're expecting to be able to, graduation is an amazing experience. So I think a 4th or 5th component of this is that we need to talk with people about kind of how you manage a loss, right? Like, not just the loss of human life that we're seeing with this virus, as well as other health ailments that aren't being treated now, right? People are dying of other things. And then also, how do you kind of navigate some of the professional loss or social loss or cultural loss that's there?
Yeah, and I think you bring up a good point. It's that people are still sick, right? I think you have immediate reactions to the COVID situation and trying to triage and treat patients. But, for instance, we see at OMA Clinic, mothers are still pregnant, babies are still being born. We still have, newborns and kids coming in for well child visits and wellness exams. We still have individuals who have chronic conditions that cannot be treated on a telehealth or a telephonic encounter or call, or just automatically assuming that our patients have access to a smartphone and internet access, just as I think the assumption has been in the education side, in terms of, okay, everyone should flip a switch and go online, as though perhaps there isn't some trauma at home that has prohibited them to even be at home in a safe environment. They have access to technology, that they can continue to kind of lead productive lives. And I think that was the second part I wanted to get to. Is you talked a little bit about health inequities as being such a important, not only socioeconomic, but I think just like a civil rights issue. And I think we've seen some of the large luminaries in the civil rights area talk about health inequities that I would argue, just being in the position I've been at OMA for the last few years and even working in the health sector, have largely continued to exacerbate, right? And I think COVID-19 didn't all of a sudden create health inequities. I think it shined a light on all the health inequities that are already present. And I think it magnified them to an extent where you saw why testing disparities are present in urban areas versus suburban areas, why you have celebrities getting tested, with a snap of a finger at a time where counties and governments didn't even have access to testing, right? So you have this kind of undergirth of, health access in this country that's available to those who pay for it. And for everyone else, they're kind of fending for themselves. And in your work, what have you seen in some of the, the term that maybe some of us are familiar with, the intersectionality of health equity, and some of the work that you've been doing on the ground in the communities, and being able to work with students and other younger adults in the community, and just communities in general.
And education is part of this intersection. At NYU, we have students who live in the library because they can't afford housing. So education is also somewhat very similar to healthcare, that you get what you pay for in many situations. Like if you can't pay for it, you have to navigate a system. And people say, well, just go get grants and get scholarships. But that in itself is extremely strenuous. It's like very stressful. I can say that, and I'm someone that has insurance, okay? The early challenges of trying to navigate what was happening in New York City from a healthcare perspective, from myself, my wife, and my child, were some of the most stressful I've ever had in my life. Because the early iterations of this virus in America, there was nothing available to you in the beginning. And then you see Kevin Durant and Utah Jazz, they can get a test in 5 minutes, get the results. NBA season's canceled. You see celebrities and people who of wealth, the 1% and above, and we as Muslims are really going to have to begin to start to go back and visit where Malcolm left us. Malcolm gave us a baton, right? Rahimahullah. Malcolm passed a baton on to us. And outside of the Black community, I don't know if we took that baton and continued to run with it. And that baton is that if you are not able to be an advocate for justice, then you have failed to actualize Islam in its totality. Allah subhanahu wa ta'ala says in Surah Al-Hadid, وَلَقَدْ أَرْسَلْنَا رُسُلَنَا بِالْبَيِّنَاتِ وَأَنزَلْنَا مَعَهُمُ الْكِتَابَ وَالْمِيزَانَ لِيَقُومَ النَّاسُ بِالْقِسْطِ. Allah sent prophets and books and justice and balance so people could establish justice. Like the whole entire purpose of sending books and prophets is justice. إِقَامَةُ الْقِسْطِ, إِقَامَةُ الْعَدْلِ. So where is the voice of Muslims on these issues? Theologically, as a theory, what is the theory of justice in America? How do we align ourselves to be really prophetic? We're not an ethnic community, and that's one of the challenges we have. We are a prophetic community. A prophetic community is one, Allah says, كُونُوا قَوَّامِينَ بِالْقِسْطِ شُهَدَاءَ لِلَّهِ. It's twice in the Quran. And the word kunu means constantly be an advocate for justice. There's a number of things that can be said. People tend to try to live justice in the past. Well, 100, 200 years ago, were people worried about healthcare? So this is like used as some kind of precedent to mean we shouldn't care about healthcare. That's not understanding the parameters of the religion well. There are actually numerous ahadith of the Prophet ﷺ from Sayyidina Tirmidhi that says, whoever provides assistance to a sick person will be enshrouded by transcendent mercy until they stop. Another narration says, whoever looks after a sick person, the angels make dua for that person. Another narration, these are good all narrations. Whoever is caring for the sick, then that person will be in the highest level of Jannah. And in the books of fiqh, you know that physicians are allowed to join prayers. Like it's one of the few exceptions that physicians, nurses, and medical staff, what we would understand now as medical staff, in the Hanbali madhab, in the Maliki madhab, they are allowed to join prayers if they are like in a critical care situation. And they can even miss Jum'ah. So if I had a family member who was sick and I had to stay and take care of them, I'm excused from attending Jum'ah prayer. So the role that we have as a religion, and if we look at our kind of legal tradition, the dispensation given to physicians and medical staff, all points to the fact that like the religion itself is compelling us to look after the health of people. Not simply just to, buy into, this is not my concern. It's not something I need to worry about. I mean, I was going to ask you, what's it like to have to navigate Medicare for the first time? Like how stressful is it if you have 3 kids, right? You lost your job, you lost everything, and then you have a COVID thing happening. You can't even go to Costco. And now you have to try to navigate Medicare.
It's so hard. Not only that, Imam, but you have to actually re-enroll every year, right? Then you have to remember when you enrolled, right? If you get your family members enrolled, then you have to figure out, if you have language issues and access issues, right? That's a big thing. About 75% of our patients are Latino, so they can't, the reading level isn't up to par, right? So they have this, forget, anyone, but even people with college and multiple degrees, you can't even figure out how to enroll properly. And we have navigators, and then you have a lack of access for transportation, right? Many of our patients, subhanAllah, I was talking to a patient a few months ago, she takes 4 buses from North Hollywood to come to South LA. Wow. I said, miss, you have so many accesses to care in your local community. Why do you come all the way here? You have a clinic down the street from you. I'll give you the resource. Why do you come? She says, no, because, when I walked through these doors, I understood Islam, that I know my provider is a Muslim female hajiba provider, physician, who's the majority of our workforce, and the care she provides for me and my family, it doesn't matter how far she would be. Yeah. But I know that her values are in line with mine, and I'm going to come to the clinic. And so it's this type of service. And, we were reflecting, Imam, just last year, what it meant to serve the same family over 4 generations here at UMMA now. And that family actually, one of our medical personnel, she started working here at UMMA because of the care that her parents received here at UMMA. And now, fast forward 24 years, we're serving 4 generations of that same family. And we have so many stories of this. People have told us countless times. I heard about Islam and Muslims. I've heard some limited things on the media, but all that went out the door when I walked in and I understood healthcare for all and inspired by Islam. What does that mean? That means you get the quality care that you deserve, that you get the culturally appropriate care that you deserve, that your questions are answered, that we don't treat every patient who comes in as a number, right? So I think a lot of times I get asked, UMMA's had so many opportunities to open up so many sites and expand. And, when ACA expansion of the Affordable Care Act or Obamacare expansion was happening, clinics are opening sites left and right, 5 or 6 sites. And if you looked at today, given the economic downturn, they're closing those same sites, right? So where was the access to the community? Was an investment made on growing, or was it actually serving the community? And subhanAllah, Imam, I'll tell you, alhamdulillah, we've been able to continue to serve. We haven't had to cut staff or furlough staff, alhamdulillah, when many other clinics have. And I'll tell you why. One of the main reasons for that, and I mean, we're struggling just like any other clinic is, but it's because we don't debt finance our way to growth. As an organization, we take no interest-bearing loans. And so it's hard for, traditional people who are kind of like, this is the business mindset. And we're reaping the benefits of that. And we share that with our patients of, we don't open clinics just because we can, right? We have the cash flow. We actually finance on the front end. And in healthcare, if you understand, Imam, and as you know, that's not easy to do because you're talking about multi-millions of dollars and able to just sustain an operation. So you don't have to take on a loan that's going to further take your clinic back and your organization back, and I think more importantly, take your community back as well. And I think another issue that came out from that is, as you know, LAUSD being the second largest school district, right after the school district in New York, now that the schools are closed, you have to remember about 75 to 80% of food that children ate in LA County came from the 1 or 2 meals that they got at school. And now you've cut off access to education, and they have certain drive-through pickup lunches and breakfasts they can do. But if you have 2 parents that need to work, who's going to take you to the school? How are you going to get that food? So food injustice became a huge issue for us. So alhamdulillah, over the last year, we started a free farmers market where we work with a local nonprofit organization, and we're giving out 30,000 pounds of fruits and vegetables to our community. Not only to the community that comes to the clinic, but also the surrounding community. So food insecurity, right? We talk about the social determinants of health, everything that happens outside of the 4 walls of the clinic. We can't tell our patients to live healthy lives if they don't have access to healthy food. And so food injustice and the food injustice justice movement has been huge. And that's been able to allow for another vehicle for us to serve our patients. SubhanAllah, it's been, it's been happened with the support of the community to enable us to kind of push forward. So I want to kind of transition to the next, question about, when you look at health inequities, and you think you touched upon it a little bit in terms of access to healthcare, some of the limitations, but I think you touched upon a little bit of our Islamic in our tradition, right? If you look at scholars such as Ibn Sina, even looking at the concept of a hospital, came from the Islamic tradition. It came from the ability to treat people regardless of this infrastructure of payment was not even there, and so for-profit healthcare system came, right? It was always understood that the state or whatever representative of the state would take care of sick people in our community, and the last thing that they would have to worry about was healthcare. And so wanted to ask you, and I've been talking to a lot of folks about where's the Muslim presence, and alhamdulillah, we've seen, like you said, so many frontline folks, even frontline news story. I don't think I can see a news story without a Muslim physician or some Muslim allied health professional being highlighted for the work they're doing, not only for their work that they're doing, but why they're going above and beyond. And more often than not, they mention their faith and their faith tradition of what keeps them going, especially in this month of Ramadan. And what message you have out there for the health professionals who are dedicating their lives now and to being on the front lines of being able to serve, and why their tradition, not only looks, so profoundly upon them for their service, but why this is so steeped in the work in our tradition to begin with.
I was recently asked by a reporter for maybe the Wall Street Journal at the beginning of Ramadan, what is actually NPR? Sorry, it was a live thing. What is one of the most impressive experiences you've had coming into Ramadan? And I said, Muslim American physicians. And she said, why? I said, well, New York City, right? And I used to live in Boston as well. And I have a friend actually who messaged me a month and a half ago at Harvard Medical, who said, I just saw a 39-year-old man go into respiratory failure, who is ripped. Guy could run a mile in 7 minutes or 8 minutes. And he was just break. And I had to be imam to a physician who's watching a 39-year-old man who has no underlying health issues, no pre-existing conditions, 39-year-old person go into respiratory failure that my mother died of respiratory failure and she was almost 80. And then after our conversation, just go right back to it, bro. So I think that after all this is said and done, we need to honor all of our healthcare folks, but specifically as Muslims, right? I receive every 2 or 3 days, on Instagram, messages from kids who say, my father, I can give the name of this person because they ask us to make dua, Basharat Ali, was a medical professional physician working in the ICU, was over 60, has now the virus, has been on a respirator, but he was happy if he dies. He's I went out serving people, man. My message to them is you're like our heroes. Like, who are we to tell you about sacrifice now? Like, what imam sitting in his library, you know what I'm saying, can tell you about sacrifice? So I think that not only is it important that you come back to us safe and sound, which we pray, but that we honor them. And then also, and I don't want to take this too far, we need to make sure, as we saw recently with the suicide of one of our wonderful physicians in New York City, that we are providing them with adequate mental health and psychiatric help options. Because the guy that contacted me from Boston basically said to me, this is like the movie Independence Day or something. Like, this is insane. Like, I've never seen this many people sick. I've never seen this many people who I can't treat. Like, I'm trained to treat them. There's no therapeutics.
Sheikh, sorry, your camera is off.
My camera?
Yeah.
Yeah, I think let's see.
Oh, sorry, 1 second. Kind of important, right? Yeah, let's do this. So that's the only downside to this camera, is it runs on a battery. So
Fine, we can edit this out, right?
Yeah, we can.
is it working now?
Not yet.
Okay, I think it should be now. Let me turn it off and see. Hold on a second. Let me go to preferences. You know, that's the other thing, man. We got this Zoom thing on lock, man. Everything that's happened.
All right, you're back.
Yeah, 1 second. Let me see. Just give me a second really quick. Let me see if this will work. Okay, there you go. So let me kind of zoom that back in so it's not. Okay. Is that better?
I think you have to switch over. We just see the Swiss logo.
Okay, let me.
There you
Okay.
go.
There you go. Let me also.
Yeah, we can see you now.
Nice. So, you know, I think it's also important that communities make sure that we're providing you guys. Hold on 1 second. That's showing. So you don't want to see that. So I think it's important that we also make sure that we're providing you guys with support, because this has been a very traumatic experience. And then I think it's important that you come back and tell your stories. I think it's important for people to hear what healthcare inequality looks like on the front lines.
Yeah, absolutely. You know, Imam, just to wrap up, you know, as we kind of conclude this month of Ramadan and all the lessons we've been able to derive as individuals, as communities, as connecting in this new virtual world, which probably will be with us, you know, in some semblance moving forward. You know, how do we continue to build community post COVID-19, right? Aside from the challenges we already had in a non-COVID-19 world, I guess, in a you know, AC after COVID and BC before COVID type situation. What's this AC situation going to look like, the after COVID situation of building community across faith, across religious lines, across, you know, going into an election cycle? I think there's so many considerations that we have in terms of what it means to build community. So what advice do you have for the community in light of all this?
Yeah, I mean, how is toxic identity politics going to, like, how is it, the people are talking about this virus kind of, you know, morphing into, what is white supremacy going to morph into, you know, in a CC, the COVID, you know, we're kind of like in the COVID era, the CA, I guess, or CE. You know, I don't know if I really have an answer. I get a sense that in many ways we may learn to appreciate each other more. You know, can you just imagine that day when this is done and you can walk outside, dude? And go back to, like, You know, like go to Trader Joe's or go to like an Aldi's, man, and just see like how long the lines are, how you have to wait, you can't talk to anybody. You know, some of the things I think that we took for granted, this is an opportunity to appreciate them. I think also it's going to really help us streamline what we work for and support. So like, I think it's very important for people to support UMMA Clinic. I think it's fundamentally an extension of prophetic justice to support the community work that you do. Community work has different levels, right? So there's the intra-communal work that we do at mosques and nonprofits, and then there's the inter-communal work that you're doing. That can't be seen as separate from our other responsibilities. So I think we may hopefully as faith communities come out of this with a greater appreciation for people. And then understanding, as you articulated earlier, this virus has exposed, I don't know if people need to read and pay attention, the inadequacies, and this is in a post-Obama era, Obamacare era, that it still is exposing grave inequalities for people. I mentioned it, I had a blood clot. At that time, I wasn't on insurance, so I was given Lovenox, which is basically like you shoot it into your stomach, man. It's like a shot, you know. And then I went from Lovenox to Eliquis with no insurance. So I went to the pharmacy the first time after my hospital supply ran out to get like a month's supply of Eliquis. It was $350, man. So I was around drug dealers before I became Muslim. And I was like, big pharma are worse than drug dealers. And I asked the pharmacist, I was like, man, like lucky at that time, I barely could afford it. You know what I mean? I actually had to ration my pills and take one a day instead of two. So it would last longer, right? Which you're not supposed to do with like blood clots in your leg. And then I asked her, like, so then I got insurance, sorry. So I go back with insurance, it was $30. So I said to her, like, what, do you remember me? I was the guy that used to pay $350, you know, for the bottle, and I'd come every 2 months because I couldn't afford to get it every month. And I'm someone that has like a job, like I'm working in the community. I'm not like not underemployed, right? Or unemployed, excuse me. And she said to me, you know, most people just don't come back for anticoagulants. Like people can't afford them. So I'm thinking like people are walking around America with blood clots, man, that are treatable, very treatable. And they're dying of embolisms because, so when we think about community, you know, when the Prophet said, you're not a believer if you don't feel what your neighbor goes through, right? Like a believer is someone who goes to sleep and their neighbor's hungry, is not a believer. Like, how are we going to expand the idea of Islamic human justice beyond simple, you know, the simple kind of stuff that we've regulated, meat, music, and mortgages, you know, the 3 M's is what we always talk about. Where are the conferences that bring together people like yourselves, where you can, like I sit on a FIT council, I plan to invite you to that FIT council, where imams can hear about, like, are they aware of like the nexus of big corporations, how that impacts food, medical services, education. All this is a nexus that's based on a beast that is alladhi jama'a malan wa malahu wa addada. It's just wanting to collect money. So when we think about community in America, we cannot separate it from kind of the toxic forms of corporate exploitation that impact everything from the prison industrial complex to the medical world. I experienced it, man. I got that medical bill from the blood clot experience. And I was like, yo, unless I win the lotto, bro, you know what I mean? Like, it's done, it's a wrap. I'm gonna die in debt. Like, there's no way I will be able to pay this off.
SubhanAllah. And I think that's what, you know, a lot of the questions we get from the community members, like, hey, you know, because you have this federally designated status, doesn't that mean you get automatic funding, and aren't you guys good? Why do you guys need to fundraise? But like you said, the costs are so astronomical, right? So one of the primary cornerstones of our clinic is it's healthcare is a right? For inability to pay is not going to keep our patients away. So we'll see that patient, right? Once they get kicked out of the ER, they've had so many visits, where do they go? They come to clinics like UMMA. They have to get their care managed.
Going to the ER for just simple, like not something simple, man. Like us with the flu. Like,
yeah,
we were contemplating, if this is what we think it is, do we go to the ER for like a flu? And then how much does it cost to go to the ER? Like, what's the cost? Everything is so amplified because they know you have no choice, right? It's hard also on you guys. It's hard on the service providers. It's not just hard on the patient. But my wife, when she gave birth to our daughter last year, my daughter was born with Coombs syndrome. So they put her in the NICU. She was orange, like she had jaundice. Her oxygen levels had dropped. And they told my wife, you can't stay in the hospital because your insurance doesn't provide you a room. So imagine, I live in Brooklyn. This is in Manhattan, Presbyterian. I have to get a hotel room at like one of those 5-star Kylie Jenner, Paris Hilton, waste of money, Shah Rukh Khan, opulent garbage hotels, right? That's like $800 a night. So my wife, who's still stitched up, can walk every 3 hours to breastfeed my daughter, because breastfeeding is crucial to the jaundice piece. So I was talking to the hospital. I was like, you can't just give her a place to sleep, man? They're like, nope, your insurance doesn't cover it. So that system is the opposite of justice. It's brutal. And Muslims are those, Allah says, have you seen the one who denies deen is the one who denies being kind to people? Like that is so central to us. If we know that people like that situation, my wife, I had to literally carry her, man. It's the first time I've told anyone about this. From the hotel, they wouldn't give me a wheelchair. You know why they wouldn't give me a wheelchair? It's not covered in your insurance. A wheelchair for a woman that just had a baby, who the baby's in the NICU? So what do you think my wife had to do, bro? God bless her. I love her. She basically lived in the freaking waiting room for like 8 days, man.
Oh,
and this is with insurance, right? Can you imagine without insurance? So they were literally arguing with me over a wheelchair to push a woman who just had a baby, whose baby's in the NICU, the ICU for children, infants, to the hotel, which is like 2 blocks away, bro. Even crutches, like, it's not covered by your insurance. So this is a system that is based on corporate greed, that is preying on people who are sick. And you know this, when people are sick, they're desperate. They'll do anything. And then so I've seen small flashes of this really unjust ethos is the word I use for it, that runs through what I call the medical industry complex. Like, it's the best way you can really talk about it. It's like people are making money. People invest in these things and make money. And God bless all of the faith groups that are involved in doing this. That's why we were talking earlier, every hospital tends to be ran, luckily, by some kind of religious organization. They're the ones getting people's backs. I don't see an atheist hospital, right? I see a Catholic hospital. I see a Presbyterian hospital. And I hope one day we can see a Muslim hospital.
Inshallah. No, Imam, I think you hit it, inshallah. May Allah bless you and your family and your wife as well for all that she's been through. And I think it's just a microcosm, and so many stories of like this that, sometimes our patients don't even have a voice to share their concerns. And that's why, regardless of their ability to pay. So if that patient comes to us, they need cancer treatment, we're taking care of it, right? We're getting the referral in. And if we can't provide the services based on our facilities, we're walking through that individual through the referral process, getting the support they need, having behavioral health case managers. I think that's the other thing. we have behavioral health integrated with our physical and primary care health, right? So the case, synopsis cannot be discussed without first assessing the behavioral needs of the patient, where they are mentally, and then coming up with a treatment plan that's also taking into consideration the primary care needs, because one without the other is not true healthcare, and it hasn't been and never will be. And now we're adding the dental component, which is so important. The number one reason for absences in LAUSD is students who can't come to school because of dental issues. So where's the justice there? I mean, they don't have access, and that's oftentimes neglected because it's the last thing some people worry about. But oftentimes it's the most important, because you can't eat. Oral health dictates so many different parts of your life. And I think you hit it on the head. Your zip code should not determine your life expectancy. There was a report done in Chicago last year. I don't know if you saw that 2 years ago. Within I think it was a 2 to 3 mile radius, the life expectancy differed between 10 to 15 years.
Wow.
10 to 15 years.
SubhanAllah.
Just because of the access of health, health centers, to fresh food, to fresh air. And these things matter. These are, when we talk about social inequities, they play into it, like you said, because people have no choice. This isn't a choice. People didn't choose to say, oh, I want to be born in South Central LA with these underlying conditions, right? I wanted to be part of the school to prison pipeline where I get arrested when I was 7 years old and I cannot get a job after that. And I have a record. And if you look at the same community in, say, some other suburban place, I get detention for 2 hours, right? These inequities have transpired through the educational system, through our socioeconomic system. It's tremendous for our community.
And most of our imams are uninsured.
SubhanAllah.
So let's not forget that this. I received a phone call from an imam. Sorry to cut you off. A few days ago, who told me that his insurance company is no longer covering his insulin. What do you do as a diabetic, chronic diabetic, when your insurance company now is refusing, out of nowhere, because it's in the fine print, right? It's in the fine print. And that's why I tell people, if you don't think that the medical business is about money, look at the stuff they have you sign. Look at the amount of fine print, man. Like it looks like you're buying a yacht. You know what I mean? Like it looks like you're buying a skyscraper. The amount of fine print in that contract that you sign. So he told me, I said to them, as a religious person, he's going to argue from a humanist, religious perspective. And their response was, you signed the contract. And we can take away what we want to take away at any moment. And the alternative is you could just lose your coverage, bro.
SubhanAllah.
And so he was actually rationing insulin as an imam. Can you imagine that?
It begs a question. I think this is a whole nother conversation, but what are we doing to take care of our imams and the folks who put in their entire livelihoods into serving the community, and they have a disagreement with the board of directors, and like you said, their medical coverage is cut off within a month, right? This stuff happens like whether you wanted to or not. Whether you sign up for additional COBRA coverage that they have or additional supplemental coverage or not, your insurance is going to get cut off. And you have a wife, and subhanAllah, since you brought that up, I've received calls directly to me about imams who've been cut off while their wife is pregnant, who needs coverage, and they don't have a place to deliver.
Yeah.
And alhamdulillah, we've been able to make ends meet and push through and some arrangements, but this stuff is vicious. I think it's a vicious cycle that I think health, if there's a waqf for health or something to establish, I think we see a GoFundMe page on a weekly basis on people trying to help ends meet, or someone had a stroke, or an imam or a community service member, Allah subhanahu wa ta'ala relieve their suffering and ease all of their suffering. And what can we do? Because it's happening so much. What's the response? Is there a Muslim group health insurance system we can perform or provide, right? Where we have networks of providers. Man, I can't, one out of every probably 3 or 4 specialists in this country is a Muslim physician that probably self-identifies as a Muslim. Forget the ones that don't actually self-identify.
And they saved our lives, bro. My life was saved by Muslim physicians when I was an imam, who would, shoot me medication, shoot me some samples, take care of me, look after me on the DL.
Yeah. And I think they do that more often than not. Yeah.
I couldn't go in. So I'd end up at the brother's house, and he would kind of, and then if there was blood work that needed to be done and all that, I'd have to handle it. But in general, that's something that also has to be talked about. Muslim physicians in many ways are the backbones of religious providers who have no insurance.
And I'll tell you that firsthand. My father is a specialist as well, and I can tell you how many meetings at the masjid after Isha or after Fajr he's had to help a brother who's visiting or family member who's visiting, someone who's maybe uninsured, providing medications, getting the prescription himself from the pharmacies. And it goes untalked about. Like you said, they're the backbone. And what are we doing to support and uplift work that not only is serving outside, but also serving within? And oftentimes it's not talked about because you think you have a job, you just automatically get insurance. But
right.
What's happening in the Imam gig economy that I think has been written about so much, about long-term sustainability, man. It's not something that can continue, and nor should it, because it's such a priority for us. And as we're addressing the needs externally and pushing forward in ways that we should, what are we doing to self-sustain? Because if that base isn't there, we know Allah subhanahu wa ta'ala has told us that He will take our scholars away from us if we don't, if you don't take heed of what's to come. Allah. So Imam, to wrap up, I just wanted to give you the opportunity to close out. And, what advice do you have for the community, for everyone? Like, I think we talked a little bit about how do we process where we are. We have these limited nights of Ramadan, literally nights we can count on our fingers left, to take advantage of some very precious moments and to not get caught up into kind of the everything else that's happening, and when we're going to open up and when are things going to get back to normal. And in the midst of that, subhanAllah, Allah subhanahu wa ta'ala has given us this opportunity of these precious nights, the last 10 nights of Ramadan. What advice do you have to the community to really maximize their time in these last few days?
Crucial to donate to UMMA. I think, that's really, people get really frustrated because there's so many things that need help, but oftentimes we need professionals to be posited in those places to do the work. So I like to tell people, I understand you're frustrated and you want to change the world, but you don't have the skill set. But there are people who have the skill set. Support them. Umar ibn Abdul Aziz used to say, I'm not a scholar, but I can support scholars. I'm not a scholar, but I'm a venture capitalist, and not in that way. But I can help. I'm a venture Jannist. I'm looking for Jannah with my capital, right? So he supported scholars. So I think one of the best things when people get frustrated and angry is make your wealth work for you. The Prophet said, whoever equips a soldier in jihad is the soldier. So whoever equips a physician, right, on the front lines is the physician, right? Whoever helps anyone in these kind of important fields is going to get the reward, inshallah, of those people's work. So I can't stress how important it is to support the great work you guys have done since the 90s, baby. Since my era, since my MSA days, UMMA Clinic has always been, really about the underserved and forgotten people who don't get invited to our conventions, don't get invited to our banquets. But that's not where prophecy is. Prophecy is where you guys are. So I hope that, people will support you all, inshallah. This last few nights, imagine, bringing healthcare to children in South LA, bringing healthcare to mothers, pregnant mothers who are stuck trying to navigate WIC, right? Imagine being able to try to support those people. So barakallahu feekum.
Jazakallah khair, Imam. Thank you so much for the work you're doing. May Allah subhanahu wa ta'ala bless you, your families, every community that you're usually in on every weekend or even weekday in any normal circumstances, and all the khair you've brought into to students on MSA campuses. And I still remember vividly, driving you around at UC Davis when you came to visit. I think 2010, I'm kind of dating myself here a little bit. It's been wonderful to see you and continue to benefit from all your presence and your work, and also the new initiatives that you're taking on with Swiss. And I encourage everyone to take heed of that and to really check out the social media feeds and the work that's being done through Imam Suhaib Webb. And also recommend you all to check out ummaclinic.org. We're going to have some continued updates, inshallah, after Ramadan in terms of our services to the community, in terms of broadening our service to the community, how you can get involved, inshallah, once restrictions are also lifted. Because volunteerism is how we started as an organization, and it's the backbone of who we are in terms of our work in the community. So jazakallah khair, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair, Imam. Thank you so much.
Thank you, man.
Appreciate it.
That's a nice convo, bro.
Thanks, man. Stay safe, inshallah.
Take care of yourself.